disease is very common. It's very ignored part of the complications of diabetes. Diabetes can lead to complications as far as amputation. It's one of the commonest cause of amputation after road traffic accident, and it can lead to ulcers, deep wound infection. It can cause very ill-formed joints, and it can cause difficulty in walking. As far as other complications of diabetes, besides eye, kidneys, diabetes, food complications are quite preventable in the sense that we can prevent this disease. But if you look after our feet, besides that, controlling sugars and having good footwear. So in the first part, we're going to talk about why diabetes foot ulcers is common and what leads to different complications. Because diabetes foot disease is mainly by two processes. The one, the nerves get affected. The other one, the vessel supply to the gets affected. And sometimes you can have trauma. So it is the poor blood supply or poor nerve supply, and the nerves get affected. And the combination of things with an ulcer or infections leads to diabetes foot disease. So as you can see, the blood supply, which can get affected to the feet, especially the far end, we call it end arteries. So those blood vessels which is affected in the far end of the feet can have blocked arteries, or the nerves which supply to the feet can get affected. So this is one of the examples of poor blood supply which get affected. Common in patients who have diabetes, who have heart disease, those who smoke, who have high cholesterol. These things are fairly common and poorly understood in our country. It's very important to understand that sometimes neuropathic small ulcers can happen in foot, which could be, you may not see it until you do a foot examination. So it's very common because the nerves get affected. But God has given a response that if you have any stone or something prick, you should remove your shoes and look into it. But because the nerves get affected, even these patients may not feel the pain because the nerves are not carrying sensation to the brain. So it's very important to look after your feet because your nerves get affected. So sometimes you have abnormal joints which can put you abnormal pressure, and the ulcers can be found in the different areas of foot, which is responsible for foot ulcers, mainly because there's what you call as motor neuropathy. The muscles part of the nerves get affected, and instead of a normal pressure of the foot pressure points are changed, and that could lead to foot diseases. So it's very important to also understand that your sweating, your other circulations areas can affect it, and that can lead to foot disease. And sometimes the infection can go in, and we call it osteomyelitis. So there are other complications like Charcot's joint, that the whole foot get deformed, and the pressure points of the foot get affected. That leads to ulceration or even amputation. In the second part, my team would educate you on how to look after the foot and what are the basic tips of foot care. But the most important is regular washing of feet, putting a cream, and looking for even tiniest of ulcer, that you should come to a doctor straight. And if you have been smoker and if your diabetes control has been poor, then it's very important to come to doctor straight. Some part of the foot complications, we call it neuropathic ulcers, neuropathic pain, which is the pins and needles that you can get it, or people can describe this pain in a different form. Some people complain that they have numbness, some people complain that there's some itching, some patients complain that there's a tingling sensation, some patients complain that there's like insects crawling under the feet, some people complain of abnormal sensation when they walk in. So we call it a neuropathic pain, and this is again fairly common. They may not have ulcers, they have nerves, which get affected in diabetes, and they get a severe pain because of that. That's also part of the foot complications, and if your nerves get affected, you're more prone to have ulcers. And it's very important to examine their feet on a regular basis, but we use specialized nerve pain killers to improve the nerve pain, something like pregabalin or gabapentin.